Welcome, everyone. Dr. Steve Rasner here. We are on the Lionhearted Dental Podcast. This week, we're going to talk about part 2 of the anatomy of a productive day. I started this last week, and I spoke about, as I have often on these podcasts, these amazing days and weeks I've had that lead to, quite honestly, an amazing practice, amazing years. I mean, it's gone on for a long time. And I'm sure some of you get busy at your office and you don't have time sometimes for the follow-up. And you then ask yourself, or probably should ask yourself, how does he do it? And I'm trying to give you a close-up picture that I hope will be provocative and have you ask questions either through an email, to contact me. Understand, this is why I do this, to be completely patent with you so I can help you achieve and grow your practice to the highest levels that you ever dreamed possible in a way that would make you proud. That's what I'm trying to do. So last week we spoke about, under the title of The Anatomy of Amazing Day, we spoke about the importance of maximizing the hygiene department. And that toward the end of the podcast, I started to speak about the clinical part, because obviously these days that happen, these weeks that come to fruition, are both a result of hygiene productivity and doctor activity. So I didn't get too far with the doctor schedule, but I was telling you that a lot of it begins, obviously, with your case presentation and what you're recommending. How could it not be that? And I implored you, which I'm doing again, to talk, to convince yourself and execute that conviction to approach patients' care with comprehensive care approach. I just don't know why you wouldn't even want to do that or try to do that. Okay? And that what I mean by that is, and I know I've said this 10 different ways. What I mean is not necessarily addressing only that patient's chief complaint. That would be easy to do. You don't need the Lionhearted podcast to take that approach to your practice. You don't even need to be listening to that if that's what you want to do. Take whatever their insurance covers in a given year, treat their chief complaint, and 30 years later have a practice of mediocre oral health care patients, because that's what you'll have. And I say that to you almost annoyingly on my end, because that is the predominance of what I see. And I know that's predominance of what you see. I mean, let's just be honest. Every month, every week, I will get new patients. And I'm not talking about new patients that were emergency only type of patients. I'm not talking about that. I'm talking about people that have full-time jobs, that had full life, socioeconomically achievers, that no one ever took the time, I'm positive of this, to explain to them that there's another way to approach the oral health care. And when you do that, you will be joyfully surprised that a lot of people want that kind of care. They just don't know exists. Do you know that a lot of patients know that they go to a good old Joe dentist? The guy that, I know I always make fun of good old Joe. I don't really have a lot of respect for good old Joe. I'm sorry, I don't. Get out of dentistry then. Or refer your patients that need more care to somebody else that wants to do that care. And the reason good old Joe gets away with it is because what I said last week, and much of what we treat and see in dentistry, is asymptomatic. It doesn't hurt. That's why good old Joe says, we'll watch that. We'll put a little patch on that. And good old Joe is half in. And do you know that a lot of your patients know they go to a good old Joe? And because he's usually a very nice guy. I don't know how good of a dentist he is, but he's a hell of a guy. And people like that. If you hear the background, it's pouring here in New Jersey as I'm speaking to you. I mean torrential rain. So if you do an exam on honestly an average patient of the people that come to see you, many of them are going to have a lot of potential to treat if they're informed about it. And let us be clear. It is so abundant. The treatment available for patients is so abundant if you just slowed down and you took the time to look at those 5 arenas I'm always telling you about. The arena of their gingival tissues. That has to be, everybody's talked about it beyond Steve Rasner. Tissue is the issue was Dave Garber, Dennis Tarnow, all the great perio-prosthodontists in the world understand that the longevity of your restorations is married to the health of that patient's gum tissue. How can we even discuss this in terms of it not being a case? So, and most of our patients have some level of gingival inflammation, whether they require gingivitis scaling or full-blown quadrant scaling root planing dentistry. And if you don't do that, then partner with your periodontist in town. And it is such a reckoning to look at patients and look at work that you've done and see it in a sea of healthy tissue versus inflammation. That's what I'm asking you to do when it comes to that. So if you would just look at their tissue, all of their teeth, not just the one that they called you with that they know is broken or hurting, all their teeth. 3, their missing teeth. Does it have an impact or not? Their bite, is their vertical closed? Do they have muscle, joint, or any other type of parafunctional wear that would impact the work you're about to do if you didn't address that? Okay? And of course, the last thing I look at is their aesthetics. And I want to be clear, if I haven't already, I very often don't replace their teeth. I very often don't even want to replace their missing teeth because if they're going to keep teeth, I want to be sure that this person who I've taken, and I think I've altered their path in terms of how they take care of their oral health. Well, how would I really know that if I don't wait for a couple cycles of recall? Are they going to, and I tell that then to them, are they going to fall off after they get scaled and root planed one time and I won't see them for a year? Maybe they don't like us. Maybe they won't come back. Or maybe they've totally bought in to the fact that this feels better and I feel healthier because for the first time in my life, my teeth don't bleed when I brush them or floss. You get me? So if you buy into that, what is going to happen is you're going to have patients that are going to seek more treatment than they have because you've only been treating their symptomatic dental needs. Okay. The next thing you've heard me talk about in terms of the anatomy of an amazing day is something I've spoken of many, many times, and now it really comes to fruition as to how important it is, and that's why we get paid up front. I've tried it both ways. If you don't remember, from 1980s when I started, to 1995, we did not get paid up front. And I got many more broken appointments, many patients that have finished their care. And so the primary reason, without any other doubt, for a patient to pay you up front, if they like what you've offered, is to complete the treatment and get to a healthier place. That's why we do it. Now, if you do that, you're going to greatly reduce broken appointments and have the potential for many higher productive type and fulfilling days and weeks. It's just a matter of fact. Okay, so the anatomy of an amazing day on the clinical side, on the doctor side, starts with the treatment recommendations. So if you don't have that down, then you need to stop this podcast and go back to the others and see if you can emulate what I recommend. And many of them, as I said last week, I started my whole podcast history. My first 50% of my first 10 podcasts were on the comprehensive case presentation. There's a lot to it. I'm not going to minimize it. There's a lot. It starts with your branding. It starts how you marketing. Case presentation and case acceptance doesn't start in the operatory when they're in front of you. There's a whole thing about it. This is what you need to believe when you look at me right now, when you hear me. I'm going to tell you that the primary reason most of you aren't busy enough doing highly productive, better patient procedures is because, for whatever reason, you haven't taken the time to put together a very well thought out new patient experience, which would include how you present recommended work to that patient. That is the number one reason you're not productive enough, that you can't even conceptualize these days that I allude to. The third reason, so the first is a great case presentation. The second is that we get a commitment from a patient by getting paid up front for all the work, even though I haven't done all their work, haven't done any of the work, and we get paid. That's a trust thing, guys, and they should trust us. What are we going to do? Take their money and not see them and do the work that they just paid for? Of course. We've been doing it this way for 24, years now, 25. So it's achievable, easily achievable. It's a mindset to you that you can't present what they really need, and it's a mindset to you that you can't get paid up front. So those two don't cost anything except a commitment by you. The third one of how we achieve, the third cornerstone, the anatomy of an amazing day, is we sedate patients. Now that will cost you time and money and a commitment. And then the first two do. The first two require a commitment, a belief by you, my friend, listening to me, my colleague, that your practice would be better if you did those. This third one, having a sedation practice, just because I say do it, that you can't do it. You got to go get a permit, either in your country, and there's many, many podcasts in this library of mine on the advantages of a sedation practice. And I don't mean 100% sedation, but I mean most of your practice gets sedated. On many, many levels is it part of the anatomy of a great day. Let me explain. I don't think I'd be able to have patients come in and be in my chair for 3 to 4 hours, which is very common, if they weren't sedated. Even if they weren't scared, I wouldn't be able to do that, because I couldn't sit still for 3 to 4 hours. I'm not that fearful of a patient, but I got sedated 15, 20 years ago when Bill Strupp did my posterior teeth. So sedation is a very big part of anatomy of these amazing days. And if you do have that, it really becomes a requisite for you to, when that patient's accepted treatment, that you just can't randomly schedule the first visit or second visit. Remember what we're talking about. How does Rasner come up with these crazy productive days and weeks that he keeps talking about? This is how I do it. The way I'm telling you right now. These are the reasons why. And it becomes a requirement of ours when Michelle says she's in, how much time you need. Either we'll dismiss the patient, schedule the first appointment and know that we have to work together. She's my scheduler to schedule out several appointments that make sense. So the way that we schedule isn't just based on how to be productive. It is, does it make sense in this treatment plan, probably the first treatment plan, by the way, that this patient has ever had. Do you understand that that's a foreign word to many of your patients? Treatment plan? Who doesn't have a treatment plan that's successful? Teachers use a treatment plan. Certainly, hospital-based personnel, whether they're nurses, surgeons, assistants to the surgeons, all have a treatment plan. And you, doctor, obviously need a treatment plan maybe that treatment plan is a prophy. Maybe that's all that one patient needs. But that would be naive for me to say that with a straight face. Because the beautiful thing that I haven't really spoke about of the Lionhearted dental approach, you know why it's so easy to be successful using this comprehensive approach and all the things you hear me talk about? You know why it's so easy? Because most of your colleagues don't embrace it. And I'm talking about something that's better for the patient. I'm not up here inventing a new phase of dentistry, trying to get you to be successful. I'm not here talking about expanding your practice with Botox and lip fillers. I'm talking about dentistry, pure, strict dentistry that we all were trained to do. And somewhere along the road, a lot of my friends and colleagues got sidetracked by insurance-driven practice that maybe you purchased. Somehow you just fell into that bad habit. And if you're insurance-driven, you're not comprehensively treatment planning people. You know, when I prepared to do this podcast and last week's, I didn't know how easy and how much sense what I'm saying to you would make until I'm actually talking to a camera right now and doing it. When I sit here and tell you, well, duh, the anatomy of an amazing day absolutely has, I don't know the percentage, but mostly to do with what you're recommending. The sedation thing that I just mentioned just makes it easy to get a lot of that work done quickly and efficiently. And I can tell you, for somebody that's used the protocol that I recommend for 26 years, and so many of you have reached out to me, and now you're using it, and now you've got a permit in your state, and now you're part of the Lionhearted sedated family that is providing better care. Because let me make it clear to you guys, you'll provide better clinical care when the patient in your chair isn't jumping all over the place or swallowing 17 times per minute to get over their mild to advanced phobia of what you're doing. You obviously will provide, whether it's a direct DO composite on an upper right premolar, or a root canal or full coverage crown, or even your scaling and root planings, and certainly your surgical procedures for sure will be at a higher level than you've ever been able to provide, because you don't have a patient jumping around or even moving a little bit. And guess what else? The patient will tell you that you're the best thing in dentistry that's ever happened to them. And guess what else, guys? They tell all their friends. So, when you have that type of practice, part of it becoming these amazing days and weeks is because you have 3 or 4 hour slots to get a lot of work done. And that work needs to make sense. So let me just explain that. Let's say you have a case where you're going to be crowning 6 through 11, but the patient has, when you met them, they also have early perio. Well, you can't scale and root plane them, which we do often, and prep 6 through 11 on the same day, because you can't impress 6 through 11 in a sea of inflammation. You understand? These things are really, really important. So another example, if I'm going to involve I had a patient yesterday, good example. So she was getting 6 through 11. This woman, by the way, I wish I had the time to tell you all the stories. She's 75 years old, which to me just isn't what it used to be. I certainly don't go to a 75-year-old any differently than I would a 55-year-old. Unless it was very, very clear that they had no appreciation and I wasn't being irresponsible by not treating certain things I'm recommending. Because you don't always have to replace teeth, I get it. This woman actually, for a lot of times the story is they put themselves on the back burner. So she was taking this, I hear this so often. She was taking care of a parent for the last 10 years. That, or somebody that she doesn't have to take care of anymore. And they know, they're proud people. They know that they put themselves on the back burner. And this woman was missing 5 and 12. And you can believe me and trust me when I say to you that when I recommended 2 implants, which I know are enormously expensive, 5 required me extracting a hopeless tooth, 12 was already missing. I want those done early in the treatment sequence because I know that I'm going to wait 16 weeks to restore them. You kind of get that when you are comprehensively treatment planning people, there are different puzzles you have to put together. You can't just go in half-cocked and do this or that. I want those implants in first so that when I do prepare 6 through 11, when her tissue permits me to do that, that I don't have to worry about changing the gingival margins of 6 and 11 because I know when I do the implants on 5 and 12, if it was after she had the restorations, it obviously could impact the gingival margin levels on her natural teeth adjacent to the implants. I know you get this. I'm just saying a lot more goes into this. Were there any root canals to be completed? So in a comprehensive case that has implants, root canals, and tissue issues, I get all them done and I tell the patient, we're going to get all the electric and plumbing done right up front. And I go further and say, and it's not going to be that exciting to you because you're not really going to see it. The way you're going to see things when I get to the teeth, which we're going to get to very shortly, and we are. So these type of conversations are going on and they're very clear because these people are making a commitment that they likely have never made before when regards to, I don't know if you can hear that thunder. I told you it's storming here. So they're making commitments that they likely have never made before. And it is really important that you keep them motivated and updated, both as to where they're at in the treatment sequence, which brings up the next part of the anatomy of an amazing day, and that's the responsibility of the clinical staff in the back. This is really important. The assistants. Because, and I don't know, I haven't decided yet where I'm going to extend this to a part 3, because certainly part anatomy of an amazing day is having my assistants do everything they're allowed to do. So it has been a very long time since your host has made and spent time on a temporary crown. Number 1, I can't do it as well as my assistants can. And number 2, I don't really care to. Right? You're going to get to a point, if you haven't gotten there yet, where you're really going to want to focus and be amazing on the things that you are great at and that you like the most. So maybe you like making provisional crowns for an hour and a half or 2 hours. I don't. I like coming in and seeing that they're amazing and gorgeous. That I love. But I wouldn't get off on playing around with the acrylic and all this stuff. And, we do them well. We do them out of the mouth technique on models we made right after I prepped, and pre-op wax ups and all the things that I know my very talented Lionhearted colleagues know how to do. So we're not talking about Luxatemp in the mouth with some half average, mediocre temporary crown that somebody made in a minute or two. No, we're not talking about that. We are talking about acrylic, well defined, razor thin margins that I spent a lot of money to have my assistants train. And if you want to know where, just please write to me. Look, everything's an investment. You want to have this kind of practice? You need really well trained clinical assistants that you will have to invest in. And some of them may leave you, by the way, even after you spend a lot of money. It's happened to me because I send mine to Florida from New Jersey. So that's part of it. And we're not going to get into that today. Well, what are all these things the assistants can do? You certainly can't have a hack dental assistant when you're doing surgery. You need somebody that if you passed out, could probably finish it. That's how well versed they are on every step you're doing. They can even recommend stuff with you when you're in a spot that's not going well. You know what I'm talking about, guys. That's the clinical team of an amazing day, of amazing weeks. Equally important, I pay my team to be there 30 to 45 minutes, whatever they need, before we start. Because we are doing complex multi-level cases that required root canal, soft tissue, scaling root planing, direct operative dentistry, root canals, and all these things. And I want to walk in. You're going to want this too, because you're not going to want to do it all forever. You're not going to want to get there early every day and examine all your charts. You're going to be willing to pay somebody that's competent and you can trust them to brief you intelligently on what you're working into in that room. And when you're done, you won't have to ask every time, what is next? What is next that makes sense? If your assistant doesn't know what's next, you're not having amazing days. Because it then becomes their responsibility. They can check with you if you're good with what. Because a lot of times I have the visits laid out for 4 or 5 visits in a row, typed. I have them typed. I did that. That's only me. Only I can do that. Visit 1, scaling root planing. Visit 1 and 2. Visit 3, implant placement. Visit 4, endo on whatever teeth need endo. Visit 5, preparing crowns. Well, maybe I don't want that for a month, 6 weeks after I took some teeth out, whatever it is. They have to know that. The front desk has to know that. I know right now it's probably starting to sound a little overwhelming. This dance, this complicated dance that I'm putting together for you. But the payoff is astonishing, and it gets less complicated. In the beginning, it is. In the beginning, it's a lot to remember. Like anything in life, as you execute it and you do it, it's the way you do things. It doesn't seem arduous. It seems, do you feel this? You get this? I've really tried to break this down over the last 2 podcasts. Whatever you want to call that, the anatomy of an amazing day, a fulfilling day, a productive day, not a wasted day or week. The truth is, they go hand in hand. Amazing days, amazing numbers go hand in hand with the day I'm describing right now that requires a great clinical team, that requires people at the reception, at the front desk that get the importance of you not standing around for an hour and a half, 2 hours because somebody broke an appointment on you. I know that's what a lot of you go through. I do. And if you're honest with yourselves, I bet you can identify the reasons why in the podcast I've just given you over the last 2 weeks to get to a great place, to get to an anatomy of a great day, you probably are leaving some of these out, if you're honest. Anyway, guys, I hope this helped you. I'm trying in total earnest to have you see the light, to make some changes. We're in mid-June here. And half the year is not even over, or is it? No, it's not. And you can make these changes. I'm going to say one more time. To have an anatomy of these great days I would talk about, the first couple changes are laborious of effort and time. You can't turn on a switch on Monday without practicing and have amazing case presentation skills or a new patient experience, or have you branded properly so you don't attract people who you have no shot of case acceptance with. And then getting paid up front, it's not expensive, it's a mindset. It is. And I certainly wish some of you would reach out if you don't know how to do it. You could even talk. She would speak to your new patient coordinator. And if there's words you don't know how to use, or I promise you, it's in your head as to why you can't do it. Why would I only be able to do it? Thirdly, the sedation part of it does make this type of care easier to deliver. And then the fourth, it's just you, doctor, crossing T's and dotting I's constantly to make sure that the team you have in place that you're really taking care of, paying well, appreciating them, all the things that go with a top level team, understand their role. Have a great week, guys. I'll see you next week on the Lionhearted.